to Vibe Cafe, a show where we give our hot takes on spontaneous and controversial topics, as well as positive vibes and maximum entertainment. My name is Tara. I do not do this alone.
Hi, my name is Larry Nicodemus, and I'm super excited to be back on the show.
Yes.
Today we have some amazing things planned for you. We have a very interesting topic we're talking about, and we have an amazing guest who's going to be coming on to talk about this with us. We've also got an amazing game plan, plus movie review, and so many other stuff. So you do not want to miss out on the show. Do stay with us after the break. The show officially continues. Don't go anywhere.
Welcome back to Vibe Cafe. As we mentioned earlier, we have a guest today in the studio. Our conversation today is about oral hygiene, the whole mouth thing. And we have a dentist in the studio to talk to us about this. His name is Dr. Akinola Lawal. He is in private practice with Teethcity here in Lagos. Hi, good morning to you, sir. Doctor, actually, welcome to the show.
Thank you very much.
Okay.
Pleasure to be here.
All right, then. To begin, let's just start with what oral hygiene is.
Yeah, so oral hygiene basically refers to the state of cleanliness of the mouth.
Right.
So over time, as we use our mouth, as we eat, as we talk, there are certain deposits that get attached to teeth, and these deposits over time they tend to accumulate, and you can't get them off with toothbrushing. No matter how hard you brush, you're still going to have them stuck on your teeth.
Right.
So basically, when we assess oral hygiene, we assess how much of those things have accumulated in the mouth, and then so the procedures that we do to get the mouth clean are oral hygiene procedures are targeted at removing those deposits.
Okay.
They are called, well, layman, they call them tartar, but we call them plaque and calculus.
Okay.
Yeah.
So yes, there's that. You having to how do you check with this? How do you check for this? Like, how regularly should one check for?
Okay, so we will check.
tartars?
We will check at the dental clinic. The patient comes in for a checkup. We just check and we assess.
Randomly?
Then yes.
Oh, okay.
Well, everyone should have a dental checkup.
Right.
Everyone. It's not when you have an issue or you're having pain or something. So when you come, we check and we assess that you need to have cleaning done. By the way, the cleaning is we call it cleaning and polishing.
Okay.
So that's what we do. So we just clean for you.
What about the flossing thingy?
Yeah, so flossing is recommended. We recommend flossing after brushing.
Okay.
Ideally, yes, because
Is it every day?
yes, every day,
Okay.
every time you brush, because when you brush, there are parts of your teeth that your toothbrush can't get to.
Yes.
Okay.
The parts where the teeth make contact with each other. So you have to use your floss to get into that part to clean it out. Yes.
Okay.
So ideally, you should floss after brushing. Then if you eat and you have food stuck in between your teeth, ideally what you should use is floss.
Not your
And
regular
not
toothpick.
Yes.
Okay.
Okay, so when you were explaining oral hygiene, you made mention of the fact that sometimes you could actually brush your teeth and you might still have poor hygiene because of certain
Yes.
causes.
So for instance, for people that smoke,
Yeah.
people that drink a lot of stuff like coffee, they tend to accumulate faster.
Okay.
They tend to accumulate these debris faster.
Okay.
So for people like that, yes, they need to be coming regularly for cleaning and polishing. And then even if you don't, even if you don't have all these habits, for the fact that you've never done cleaning and polishing before,
Okay.
and you're an adult, you are most likely going to have some of those deposits. They tend to be found very close to the gum.
Okay.
So if you look closely, you will see some yellowish, sometimes brownish, sometimes it's black.
Okay.
So those are the things that we go for.
So how often is advised for an adult to get scaling and polishing done in a year?
Twice in a year, once every 6 months is
Wow.
what we recommend. But there are cases where some people, like for instance, like I said, like for smokers, it might be more frequent.
Okay.
Yes, but
All right.
the minimum is twice a year.
Yeah. So I just wanted to chip this in, the whole brushing thingy.
Okay.
We've heard several times how you shouldn't scrub too hard, how you shouldn't. Maybe just for the sake of this conversation, tell us how we should brush. Should we go
Okay,
gentle? Should we
so
go
yeah,
hard?
so you know, there are different kinds of toothbrushes. You have
Yeah.
soft, you have medium. So generally, we recommend the soft toothbrush. The harder ones tend to they cause wear of the teeth over time. You know, so we recommend the soft toothbrush. Toothbrushing is more about the technique that you use and
Not
less
the
about
brush.
how hard your brush is. You brush, use a soft toothbrush. It's adequate, and you use any toothpaste that contains fluoride. Usually, if you check on the toothpaste, you'll see that there's an endorsement from the Nigerian Dental Association (NDA) that shows that that toothpaste contains fluoride, because those are the only ones that they generally endorse.
Okay.
You know, so you brush twice a day, and you try to brush it upward and downward strokes. Try to avoid moving it from side to side, because this has like what we call a sawing effect on the teeth.
What does
So-
that mean?
So it tends to, you know, like when you are using a saw
Okay.
on wood. So when you're doing that, it can be cutting away gradually at the substance of the teeth. So you try to avoid that. Just go from down up on the lower teeth,
Okay.
then from up down for the upper teeth all around.
Okay.
You brush the outside, you brush the inside, and you brush the surfaces too.
Okay. And
Yeah.
the tongue.
Yes. Now for the tongue, so generally speaking, the tongue is designed in a way that it cleanses itself. But for you to have a fresher breath, you can always use your brush on your tongue. Then there are some special tongue brushes that are being sold now. You could also use that, yes, to brush your tongue. You know, and sometimes after brushing, some people say that you have to use what we call mouth rinses, like Listerine, like Custodial, but yes, they are good too. But usually we recommend them for people that cannot actually brush very well for some certain reason.
Right.
You know, because ideally the toothbrushing should be enough, should be adequate. Do you understand? Then there's also this thing that people talking about not gargling with water after brushing.
Yeah.
Yes, so there's actually a scientific basis for it, in the sense that you want to keep the fluoride in the toothpaste in contact with your teeth for as long as possible. So some people say you just brush and you don't rinse, just leave it like that. But really, that would probably be more effective maybe in younger patients.
Okay.
You know, when you're much older,
Yeah.
your teeth are already well formed. You know, just brush, and it's as long as you brush well, you don't need to keep the toothpaste in
Okay.
your mouth for yes.
Oh, so many questions I've got. I'll just quickly ask this one, particularly about people that say you do not have to brush before eating, like have your breakfast before you brush. How healthy is that?
Okay, so the idea is this: you want to keep your mouth as clean for as long as possible. So if you brush before you go out, then you eat all through the day, and then you come back at night and you brush. Last thing, you've exposed your teeth to food, sugary stuff, all that throughout the day,
Yeah.
starting from breakfast, lunch, dinner. But if you have breakfast first, then you brush. You only expose your teeth to lunch and dinner before you brush at night. So ideally, you should brush after breakfast, and then the last thing at night before you go to bed. But for different reasons, psychological reasons, some people just feel like they have to brush before they have
So
their
it's
breakfast.
healthy
So
because
it's-
I personally, if I wake up in the morning and I don't brush, I don't even feel comfortable.
Yes,
Yeah.
that's what I'm talking about. Some people don't feel, they feel like they have to brush first
Yeah.
before anything. So
Right.
it's still okay, really.
Okay.
But ideally, the ideal is
It just reduces it.
yes,
Huh.
you eat first, then you brush before you go out.
Oh wow.
Yes.
Okay.
This is the part of the show that we call Fact File. On our fact file today, we have something, I mean, from a research carried out. This whole oral hygiene thing is easy, to practice and whatnot, but still, we have that 3.5 billion people still suffer from oral diseases. Do you agree with that research? And also, how do we reduce these numbers? How do we prevent that? Obviously, you've talked about brushing and whatnot, but I'm sure there's some other ways. So let us know what those ways are.
Yeah, so by far, the commonest disease affects everybody, almost everybody, is we call it gingivitis. Yes, this is an infection of the gum basically, and it is caused by this same debris that we're talking about that cause a bad oral hygiene.
Right.
So because they're so close to the gum and they have germs on them, these germs are going to find their way into the gum and cause some form of infection, the swelling sometimes. So basically, the person will notice that it's very common that anytime he or she is brushing, there's blood coming out. Maybe there's blood in this in the whatever comes off of this in the sink or whatever.
Yeah.
It's coming from the gum because they're already infected. So that is why regular dental checks and skin and polishing is very, very important, because that is what. So once you reduce the quantity of those debris, the gum should naturally recover from. But it affects a lot of people. If I check 10 mouths, I'll see it in about 8 or 9. Yes.
Okay.
I mean, obviously, if you have bad breath, go check out the doctor. We don't have much time. But lastly, if you know someone close to you has bad breath, what's the best way to let them know? Because it can be a struggle sometimes, having to tell them.
Is that a dental question? I don't know.
No,
you find a way to tell them. Well, I think it depends on how close you are to the person.
Yeah.
I mean, if it's your spouse, you could be helping the person, because bad breath can be a bad thing, especially if it's really bad. People tend to avoid you. They don't want to talk to you. They don't want to, they may notice at your office. They won't tell you.
Yeah.
So I think it depends on how close you are to the person, and you find a way to just tell them that.
Just come right out and say.
Let's go visit the dentist.
Oh, wow.
I wish I could ask one more question. So it's about my molars. They keep growing every now and again, so they hurt. One time when I went to the dentist, they asked me to take it out because after all I don't use it and whatnot.
Okay.
Why does that happen?
The last one?
Yeah, the last, both actually.
Okay.
Yeah.
So it's your wisdom teeth. Yeah, so because they're the last teeth to come out in the mouth, many times there isn't enough space left for them. The other teeth have taken up all the space. So they try to struggle, maneuver, but many times they get stuck, and they could be stuck in different positions. Some of them are just a tiny bit of it shows through the gum.
Yeah.
While some it's all out, but it's bending this way or bending that way.
Yeah.
So we call those kind of things, we call them impacted.
All right.
You understand? And usually when they're like that, they usually can only cause problems for you. You'll be having recurrent infection, recurrent, pain. So the ideal treatment is just take them out. There's some other things that can be done if we assess and we feel that, okay, this one is almost out, maybe we can do this. But the ones that are really badly bent, or completely covered, it's best to just
take them out. My God. All right. Thank you so much for, sharing your wealth of wisdom with us, for coming on the show. We have so many questions, but unfortunately, because of time, we cannot ask all of it. So maybe next time, maybe another time, or on social media. But whatever you do, do not go anywhere. We will be right back because there's more to talk about.
Welcome back to Vibe Cafe. This is the part of the show where we get to review a movie of the day, and today we are checking out Fine Wine. Ooh. Sarah, wait, what? You don't like? I can tell that you didn't like it from your look.
They wanted to do one American Kiniko, but they didn't really get it.
How? Because it's wine?
Yeah.
It had a winery?
Yeah.
So you thought, only Americans can...
he was giving me that perfect pairing kind of feel.
Yeah,
Like, okay, rich
winery.
man,
Yeah,
he
yeah,
wants
yeah,
to make
yeah.
his own winery, and then he falls in love with a girl. He's just, it was biting me when I was watching it.
Really? You didn't like it?
It was not altogether bad. I'd give it a 4.
Okay.
A 4/10. It wasn't altogether bad, but then again, I don't know what it is rather with Hollywood and unnecessary scenes.
Hollywood?
Nollywood, my bad, and unnecessary scenes. Like they have that a lot. So it just spoils the movie. It drags in. At some point you're lost. You're not finding it interesting anymore. But yeah, the whole idea of, that girl being lucky, falling in love with someone really older than her, we talked about this toxic relationship thingy, bad red flags and whatnot. I wonder how she still stayed. You're in a relationship where this guy is treating you like that, and you let it happen more than 2 times.
I know, right?
It
wasn't. It was until she met the other guy, and then so. But then again, sometimes it's possibly because you don't even know that there's someone out there that would treat you the way you want, and then when you get that treatment, you're like, "What? I've been settling for this."
Yeah.
So I guess that's what the story
happened.
was all about, which I thought was very relatable because it's something any girl can relate to.
Very true. Yeah.
You probably know a friend who's been in a relationship like that, even if you've personally not been in a relationship like that. So it was really relatable, and I love that about the film. It's a feel-good show. The acting was good to an extent. RMD did good. The girl that acted the lead character, I thought, did well as well. There was no part where I thought she was overdoing it or, so the acting was good. What else did I like about the film? Yeah, those are pretty much the only things that...
So what are you scoring it?
On a scale of 1 to 10, I'll give it 5.
5/10.
Because the cinematography wasn't that great.
Right.
The sound wasn't that great as well. I had a problem with the sound.
I did too.
So yeah, because of those things, I wasn't feeling it so much. But the story was good. And then there was another thing I noticed. This man was playing the role of a wealthy man, right? He was, supposed to have made it to Forbes list. They showed his kitchen, and I'm like, what? You can't be that rich, and and
it might
then
just be one of the kitchens in his mansion.
Nah, and then you're spoiling the girl for her birthday, and you're doing this grand thing, and then you're taking her on a boat cruise in Ikoyi. I was expecting some Christiana Grey type flying me on a private jet to but it was just nah.
And then your necessary friendship scenes, like the old man and his friend always. What are you guys talking about? It was just weird, and I just cringed a lot. I'm like, I just smiled.
Because you're obviously showing us that you're spoiling this girl. There was a scene where they went shopping, the daughter bought her clothes.
Dress and whatnot.
But I just felt like that was weird.
It was a weird scene. Listen, we do not like to spoil movies for you, but hey, it's still watching. Go ahead and see the movie Fine Wine, and maybe leave your own review online or wherever. Okay, thank you so much for being here. Do not go anywhere. There's still that lovely segment for us, the game time, up next.
Welcome back to Vibe Cafe. This is the part of the show where we get to play a game.
Yeah.
So today we are playing a very fun one called the Whisper Challenge. What will happen is we'll each take turns to wear a headset, play loud music, and the other person says a phrase. We have to read the person's lip and then say what they said.
Ready?
Are you ready for it?
I am.
Okay.
Always ready.
All right, let's
move. Headset on, layering, music playing,
All right.
and let the game begin. Let's go. Today looks like an amazing day.
What?
Today looks like an amazing day.
What?
I mean, you're supposed to guess. Today looks like an amazing day.
Can I see your eyes?
You're looking right at it. That's not what I said. Today looks like an amazing day.
Say your name.
Oh. No, that's not what I said.
Okay.
One last try. Today looks like an amazing day.
Huh?
Yeah. Today looks like an amazing day.
Mete mete.
What language is that?
What are you saying?
Today looks like an amazing day.
Oh,
My
your turn.
My goodness. Come on. Be nice, Larry.
Okay. Christ in me, the hope of glory.
Say again.
Christ in me, the hope of glory.
You asked me something yesterday?
No. Christ in me, the hope of glory.
What is the name of my ring?
No.
Oh my God.
Christ in me, the hope of glory.
Rice is made up of something. What did you say? My goodness.
Christ in me, the hope of glory.
Okay, your turn. Go ahead. My good. Wow. Wow. Okay. My God. Okay. Fella has children.
What?
Fella has children.
Huh?
Fella has children. Go ahead and guess.
Rena has children.
Oh, okay. Close, but no, that's not what I said.
Let's go again.
Fella has children.
Huh?
Fella has children.
Laren has children.
No. Do you have children?
I know you said children.
Okay, so say the
think-
name I said. Fella has children.
Huh?
I don't know. Fella has children.
One more time.
Fella has children. Say the word. What did you
You
hear?
don't have children?
I don't. I actually don't have kids, but I said fella has children. Right?
No,
0-0. Yes, you were. Yes, you were.
Okay. The doctor says shawarma is good for the body.
The doctor said something. I did catch.
No. The doctor said I feel like you heard that a bit when you're shifting the thing.
What? Oh,
Wait. The doctor said shawarma is good for the body.
help me.
The doctor said shawarma is good for the body.
The doctor said do something for me. How many guesses have I made? Okay, one more. My God.
The doctor said shawarma is good for the body.
I'll just keep dragging this. I know I heard the doctor said the rest.
Shawarma is good for the body.
You said all of that? Come on. Okay, last round. My goodness. What? Sure. I hate to order things online.
Huh?
I hate to order things online.
You hate something.
Yeah, so what do I hate? Headset on? I hate to order things online. I hate to order things.
You hate something online?
What did I say? That's not what I said, but you're close. I'm making this easy for you. Headset on, one last try. I hate to order things online.
Huh?
I hate to order things online.
You hate dating online?
I do, but that's not what I said.
What
I
is it?
hate to order things online. My last one. Let's wrap this up, okay? Oh my goodness. Such an interesting game. Okay. Oh.
The fashion police did not like her dress on the red carpet.
What's all this long talk? No. The fashion business is... Okay, one more.
The fashion business, go. All right. The fashion police did not like her dress on the red carpet.
Larry. I can't. I'm still hearing the fashion business, something.
Wow, you are really interested in the fashion business.
One
Okay.
last.
The fashion police did not like her dress on the red carpet.
I would be able to. The something in me.
Christ in me.
What was that?
The fashion police did not like her dress on the red carpet.
I heard fashion. I read fashion. 0-0 though.
No.
Did you get anyone?
I think I did.
No, you did
No,
not.
I did not.
You did not. None of us did, sadly.
But
That
I was
a
very
lovely
close.
game.
Anyway.
An amazing game it was.
Yes, it was. Hope you enjoyed it just as much as we did playing it here for you on the show. We do this all the time, so do join us another time on the show because we do this every other week. In the meantime, do follow us on social media at Vibe Cafe Show. Follow me at Larry, Nick, and Tara
_TTARRA.
All right, do have an amazing time. Bye.